I'm joined by another two of our amazing global leaders. From Thailand, Dr. Atchima Suwanchinda, and from Germany, Dr. Sonja Sattler. Sonja and Atchima, it's amazing to be sitting here talking with you today. So I'm in the Cotswolds, UK. Atchima, you're in Thailand just now, not traveling anywhere else. And as I know you always are. And Sonja, but you're not at home, are you?
No, I'm actually in Dubai. I'm traveling a bit at the moment, yes.
Yeah, international women.
Yeah.
So this series is all about women leaders, and like everybody who's involved in this, you are great examples of true women leaders in the field of aesthetics, recognised by many people in many countries. And you are, for me, again, what true leaders are meant to be. Like, you do everything. You've published amazing publications that have, again, changed the way we think. You've stood on many stages across the world and continue to do so. And you also mentor and help many people, and many young women particularly. You mentor them and help them to move on to the next stage. So part of this is like a point in time where we just stop and say, like, this is amazing. But also, for both of you particularly, you have worked a lot together, haven't you, over the years? So Sonja, how long have you known Atchima for?
Well, to be honest, I think we met on the Philippines. And I think it was 2008, 7 or 8. And
I think it's a long time. Yeah.
Yeah, it's more than 15 years, definitely.
Yes.
Yeah.
So now we become like, real sister, even though you're, live across the world, but it's like sister.
Isn't it interesting how this group of people who travel and are global leaders, but they have a community, particularly amongst each other, and sometimes see each other more than family do.
Yes, we bonded.
Definitely.
And tell me about that. And tell me about ISDS then. So you obviously have a long time worked on the formation and running ISDS together. So tell me, how did that happen? And what was it like working with each other?
Well, to be honest, it was me who took over the headquarters of the ISDS in 2004. And at that time, it was a financial disaster, let's call it like this. It was my objective to really run this society into a nice, smooth level, and also to open it more to more countries, because at that time it was only Europe and the US. And as I love to travel anyway, and I love Asia, it was me pushing it to go abroad to Asia. And ISDS developed through Thailand, through the Philippines, through Korea. So we organize congresses together, actually, beside our daily work with patients, and also beside our congress, speaking.
To me, I think Sonja is very exceptional. She's unique, and she's a true leader. It's not just only like, woman leader, but she's leader. I mean, she has unique potential that she can do anything. I admire her for that.
Yeah, me too. And Sonja, do you see yourself do you see yourself now as like a global leader? Could you see yourself as that?
To be honest, at that time, never, because I knew I was kind of strong, and I was leading quite a big clinic already at that time. I started very early at the age of 28. 28 years old, I opened together with my husband Gerhard the clinic, and he was 12 years older than me. So I was more or less pushed into this position. And to be honest, it was the best what could have happened to me. And my background in the family is I have 5 brothers and no sister. So I have been very strong all the time. So at the end, yes, it's joyful for me to be a leader, or I love to be a role model also for the young ones now.
Which you are.
But
and Atchima, for sure.
Atchima is super. Atchima, I know I went to many conferences to Bangkok and Thailand, not only the ones we organized together, but she is a true honorary leader in Thailand as a female in the universities and all around. And she has so many students, developing students to become leaders. I think, Atchima, if you admire me, I do admire you as well, a lot.
Thank you. Thank you so
And
much.
if you
Like
think,
we complement each other. Yeah.
so in your journey, Achima, then, like, so you, to get to where you are now, in your environment in Thailand and Asia as one of the most prominent leaders, full stop, globally, and also women leaders within aesthetics in Asia Pacific, but of course globally women are not, of course. Major publications, major innovative publications. Like in that journey to get to where you are just now, can you remember like the times when it felt like super difficult? Like a point where you felt like you really had to push through?
Well, I would say the innovations that I made, the publications about the technique, innovation technique that everybody using it. Um, I'm thrilled that I, be able to be a legacy in developing an innovation or a technique and be able to be a model of, my Asian country. And I think the difficulties that I have been through this is when I presented, one of the big meetings, and then I was among all the male plastic surgeons, and they don't think it's possible, But at that time, I actually also did the live injections, but they actually let all attendees go. But I've been doing injections, and then when I finished, they just said, "What you did, but it's actually worked." I feel like, yeah, I know it's work because I've been doing it for a long time. You just don't believe it. I think it's is one of the obstacle, maybe because I am derm and they're plastic surgeon, or maybe because I'm female. I'm not really sure, but that's the hard part that I actually, been through for that one. But I think um, that's the ignite, the inspiration that I have to publish this. I have to make everybody know, how's that happen? I mean, what's the mechanism of it, and what is my thought? So basically, that the state actually that pushed me to make it become like publications. And I actually corroborated with my colleague, and I think it's the power of collaboration with the colleague who actually have another expertise. And then when we sat together, we discuss, and then we come up with, even greater idea, expand the idea, even further. And that even, make me feel, happy, content. And I, you feel a meaningful of your life that at least, you in the journey of you being physician, you actually have done something very nice to everybody. you
Yeah.
Yes.
And do you think that's so interesting, Achima? I remember that feeling, like of having to push through. And I also think that there is an element of gender bias where to be believed, and we even see that in studies, that on boards, on like on executive boards in companies, like men are like multiple times more likely to be believed just believed in what they say than women. Like, so that feeling of like that, no, it really is true. And then, and also the claiming of it. Do you know what I mean? Like, Sonja, do you know what I mean? It's like that claiming of it, like it feels like, so Atchima, you're so giving and you're so clever. But the point where you had to kind of be like, do you know what? I need to claim this. I need to publish it and say, here, you know, this is mine. I did make this up. Do you know what I mean? It comes from my innovation.
Yeah, right. But I'm super happy that I did it.
Yeah, and you claimed that. Does that ever, so
Yeah.
Sonja, did that ever feel weird, like for you, like standing up and saying, no, this is mine, like that? Do you think that's it?
No, it doesn't feel weird to me at all standing up and say, this is me. And, you know, my history is that I was raised together with my husband, and my husband was always the one more outgoing in the beginning. And I was always the one doing the business, but the business was in the background. Also for ISDS, I always faced male. And then this blonde German came and wanted to do a contract, you know, in Korea, for example. It was not so easy to tell you, because as a female, you have a different, well, they think differently about you in the beginning. But as I told you, I was very strong all the time, and I even left Gerhard also his stage. But I think over the time we developed together nicely, very nicely, and then he gave me the stage as well, and that was good, because especially in minimal invasive, it was more me the last 10 years probably who did these little innovations and the little technical innovations, because he was much more with liposuction. So for me, it was time to stand up and say, okay, this is Sonja. It's not only Gerhard, it's Sonja who really does the show. And it really helped me a lot also teaching my own young team. Because my own young team, the young doctors, they always came up to me and said, "Oh, Sonja, I learned so much from you. Can I follow you again? Can I be with you one more day? Because I had this and this issue with the patient." So I felt so comfortable after a while, which then, of course, I could also put on stage or into my hands-on trainings, which I give worldwide. It took a while, to be honest, but I'm super happy that I could do that, or I can do that now, because I feel very comfortable. And just recently, last week, I went to the US to a surgical conference as a keynote speaker, all other male and me. And then I posted some pictures, and then the first comment from a good friend, not a medical friend, was like, "Oh, Sonja, you're the only female on stage again." And it's still, for me, it's super to know that us female, we can really deliver so good things and educate so nicely. And I think we are not, we are smoother. I don't know if you know what I want to say with that. We can deliver, but we can also have the positive energy to our other female young doctors just to do the same, because we need them all. They should become famous in the future too.
I think, what you said, it's just it's amazing the way you are. But for Asian for Asians, MD female, it's difficult. I mean, you're a very strong person, very strong female, very strong personality, and as I said, you're very exceptional. I'm gonna say that being, Asian female MD and trying to doing this is not easy. It's not easy. So, but I'm so happy at the moment in terms of what I have done so far in my journey of, being a cosmetic dermatologist, and do some change of my country. I would say my country. So I would say that uh, what is actually happened is starting from ISDS actually. Starting from ISDS, starting from, organizing the conference, that make me more of, have to be strong, have to gain strength, have to put everything through, have to, make everything happen. And it's not easy. But, when you done one and you do second and you do third and then you fourth, and you just, you just get used to it. And any obstacle that come in, I have to find a way to overcome it. I have to find solutions. I have to make it happen. And I'm so happy because what I have done to Asia and what I've done to Thailand, and now Thailand become a medical hub for aesthetic conference. And I'm so happy. I have to thank ISDS. I have to thank Sonja. You also a model to me. So I look at you, how you be able to organize congress in Asia. It's not easy because we have different culture, even the same Asian country, but we have different culture. And you just did so well. And I look at you, I'm just like, I have to do this. I look at you and it just give me inspiration to do better. And I actually did. I'm so happy. And I make, we actually did a lot of cadaver course. And I believe that's changed the way that, our practitioner in Thailand do injection. So we do it safely and we do it more efficient. And I would say that because of the patient's contrincity that I try to do, how can I do better for my patients? How can I, make the best of what I do for my patients? And I think that's also another drive that make this happen. So we're the first group in Thailand who actually start the cadaver course. And I would say that the inspiration is come from ISDS. ISDS is the first group who actually have cadaver course. And I attend cadaver course and I'm like, I have to do this for my patient. I have to do this for my people, my Thai practitioner, because I know how good it is. I know it's going to be so beneficial, for, both practitioner and patients. And then we did, we start and to invite everybody, all the global expertise, global speakers come in. And then, we learn starting from day one, from know nothing. And now we do more than 10 years already for cadaver. So
I have been.
yes,
Me too.
you did.
Me
How
too.
do you there? And you have no idea that you actually shape the way that, Thai practitioner is doing, the treatment for patients. And that's, you have no idea what we actually did change and shape, the aesthetic practice. And it's so beneficial for patients, safer and more efficient and more natural. And I think that's also the first, also, I come up with all the technique. My innovations is actually coming from anatomy. It's coming from the basic of anatomy knowledge, and the knowledge that I learned myself from organizing the cadaver, learn from, all the speaker that I invited. It just inspired me to, have innovations to, get
Yeah.
get the best for my patients.
You know,
Yes.
Atchima, when we met, I have met Kate just before, I think, in the Life Surgery Symposium in Darmstadt, because this was when I started organizing conferences. And I think, Kate, you were one of the speakers in the beginning of 2000s, and you did already then start to invent different styles on injection techniques with the cannula. I can remember that because at that time we were all trained with needle, and you were one of the first to show live the cannula. And you see how things evolve. Now everybody has cannula.
Yeah.
And I think you can be super proud. you remember when we first did the first ISDS spring meeting, and you know
Yeah.
why it was called spring meeting? Because, and I have to say that very silent, the the officers of the board of the ISDS thought Sonja is crazy. Now she wants to enroll ISDS into Asia. And I said, of course, we have to take Asia with us. And they said, oh, you can do it, but not as an annual, only as a spring. And you know how we started. It was very
Yeah.
little. And you always said, oh, we have no society and all that in Thailand. Look what you did now. Over the years, how cadaver trainings, a society, everything is brought into place. And there's like Emily Similar and on the Philippines who started the society. And you know, it's always done by the female, to be honest. So all inventions and all these procedures, we started with the female power. And I'm super proud of you, Machima. I know, I even came for one night to Bangkok just to fix things. Can you remember? So
Yes.
we really did crazy stuff, but we did so good for education, all of us. And
Yeah.
I really love to see how it's now flourishing. Education is flourishing, and we see, of course, we see complications all over, but we see that we really put things into place and regulate it into a nice way for all aesthetic physicians, dermatologists, and also plastic surgeons. I think
Yeah.
we did very well. Kate.
And what is great to realize is that this is what leadership is. Like, that's why I'm saying you absolutely truly, it's not a light term. To be a global leader, to be at that level, which you are, is not a light term. You have done the work. Like, years and years of changing, directing, having a vision about where you want aesthetics to go, pulling it and putting all that hard work in. As we've said in some of the other series, it's exactly the opposite than just, a little bit on social media where you say a little bit of something controversial and think that, no, this is the reality of really, truly leading and changing the field. So for me, the hallmark of both of you as leaders is innovation, for sure. And the way that women work together and that we innovate together and trust each other with our innovations. And we're thinking about now how we see the future and how you see the future. So where do you, from this point now, having hauled us into this position that we're at just now and all the brilliant things that you have helped us achieve in the world and the field of aesthetics, where now? Where are we going to go now, and what is interesting you about the future of aesthetics? Where would you see us? Where would you see us going?
Okay, Kate, I just gave a lecture on that actually too, because I think we have a total different approach nowadays. Because the young generation is acting differently than all of our generation. So Generation Z, they really come early. So the earlier you come and you have a guidance, then the better you can keep your youth and, like this topic, prejuvenation, however you want to call it, but keep the structure and function of your tissue. And I think this is, we are thinking more in keeping regenerative processes, yes, but we want to keep the function of, and we start earlier, much earlier. So the topic of my talk was, do we need aesthetic surgery, like facelift surgery in the future? And to be honest, I don't think so, because we have so many modalities. So when the young generation is really starting early enough with our combination possibilities, meaning biostimulation, meaning also filling, meaning energy-based devices, and combine it correctly with the right assessment, I think we don't need a facelift surgery in the future. Of course, if you don't do anything, you do need it. But I think we will reduce the surgical approach a lot. And we do many, many more safer procedures because we know more. We want to know more about our products and companies do better science now in the background, better research. So we know more what to do and not what to do and how to combine. And I think we have such a wonderful field at the moment, and the future is so bright because we can play around and find out, and we will become better and better. I'm so sure. And we keep the function of our skin and our tissue. I am pretty sure.
Totally agree with you. And I think the trend will be non-invasive. All the non-invasive treatments that keep, people young, that also, doing prevention of the aging process. And I think that's the way to go. And I also believe that the next, era is about personalization. We more focus on, individual needs. We more focus on individual problems. We treat people differently. And I think it's with the AI power of the AI technologies also help, to create something more personalized and, what needed, for each patient. And the other thing I would think would be the anti-aging from within. So it's not just the outlook of, the beauty of you, but it also the health need to be. I mean, beauty has to be from within. It has to be from the healthy tissue. It has to be from, the a good immune system that will make the healthy of the face and the body and healthy of rejuvenations. I think that's the way to go for the next generations, the next era.
Atchima, you will see that this is functioning already now in the young generation because they eat better than we all did. They go to the gym regularly. They do many things from inside already now much better.
Yes.
So they use UV sunscreen, and they. So I think they are really on a good track to combine what we can do from outside and inside. I think we are really on a good track.
And I think also because what you're saying is, so what you're saying basically is the ideal and the expectation of younger people is that they will never get to the point where the structure and function of their tissue has degraded to the level that it has to be resected and artificially lifted. And so, but I think the key thing about is that this is not a superficial thing. It is genuinely, the aim in the future will be genuinely structure and functionally maintained younger tissue.
Yes.
Rather than just the appearance of it. And then therefore, this is the game changer. It is genuinely younger. And that may take a combination of approaches from, external, you'll have systemic treatments, you'll have localized treatments, and you'll have how that interacts with the environment. And then you'll have some things which are, topical as well. So you'll have a sort of combination where you think you could genuinely keep people where they are. But it's interesting, Atchima, what you're saying about AI. And let's have a little think about AI, about where, it's interesting because I think a lot of people don't really understand what AI is. And why that could be of benefit and why that could be of risk as well. So for the benefit, we understand AI. So my partner studied AI and has worked in AI for over 30 years. And so I kind of been brought up with it. And so it's interesting because the process of AI, of course, is machine learning. And the fact is that it is intelligent only as far as that it can predict patterns. Given enough data, give it enough information, what it does is that it's able to see patterns that we can't see because it's so complex. But what is put in by humans is value to that. So if you say, and look at everyone and say, well, this AI can predict beauty. Yeah, that's good because it can detect all these different dimensions and the mathematics around what we think of beautiful, but who said it's beautiful is always human. Now, and that's interesting because there's where is both the power of it and also a potential risk of it, because embedded in that is human bias.
Well, yeah, I totally agree with you. I totally agree with you. It's a double sword. It's the double-edged sword. It's such a having a benefit, but we also have to concern about its potential bias in terms of AI algorithm, and also the data that they, because it's based on the data. So if the data is not big enough or is not cover all the diversity, then we have a problem. So I totally agree with you. So it's good, but we still need a human contact. Still, we still need the dermatologist, and the human-centric approach, I think, is still important. So not just the AI. AI is helpful. We must know how to utilize, in the right way. But I, don't think that it will replace anything. But I can't, I can't say that it's really helpful in terms of, we get diagnosis maybe sometimes better than human eyes, because sometimes we miss things. So
Like
AI,
skin, particularly as
yeah,
dermatologists. Yeah, Atchima, what do you
right,
think about the
right,
assessment of skin? Like where it's only
right.
visual, it's not to do with shapes or anything. Do you think that has more power with skin, potentially AI diagnosis, than it would be, say, in terms of shape and art?
Yeah,
No.
yeah.
Oh, okay.
Maybe you want to say something, because I know that Sonja working on the project of AI. Maybe you
I
have something to
just
share.
published on AI. Just last month, I published the Facial Aesthetic Index, which is a
Yeah.
objective measured aesthetic outcome AI. So this machine has been trained by us, by not me and myself. It's a global team of physicians who have really long-term experience, and we trained the machine with our knowledge. I think we were more than 20 for the Caucasian group, and now the Asian group is working on it as well. I know. And this machine for Caucasian is really validated, giving you a measurement of your individual aesthetic. And nobody needs to be scared, I think AI machines can really help us. And this one is more helping for the assessment, and then gives you also an idea what to do best next for this patient to have a more aesthetic individual outcome. So it's super interesting. I think we are just at the beginning, but I truly love to collect more data, and the machine is now learning, and it's in my clinic now, data learning every day. And I think it's the future for all of us, that we use the help of AI to become better for an individual result. And the big fear is, oh, we look all like alike. That's not AI. If you have trained AI, like this machine has 17 landmarks and 1,000 combining possibilities, it's so individual. You cannot have the same outcome for everyone. So I think we will have a good future in AI for us.
So what? But so then, devil's advocate, then Sonja, which is 100%, and yes, the as soon as people think it's simplistic, but it can be super complex, can't it? The outcomes of AI are not simple. They can basically take everything that an expert can know to a certain extent and implement it. But what happens then? You have, like, when the word of AI, and it could happen, you have the AI says, you should have this. And the patients are interacting with that, and they're like, okay, the AI says this, but you're like, actually, no, in this case, because that's one of the issues with the AI, is that sometimes it can come up with wrong answers or weird answers. This is known. So it just, because it's just looking at patterns. So the problem is that sometimes if that algorithm, for example, or AI is out to the public, right? They're assessing it. The AI assesses them. It can do this kind of you can change your face and then look and see, oh yeah, like I can make my face change this way. I check it. Now I know what I want. The AI has told me. I will now take this to my practitioner. And if they try and disagree with it, no.
No,
Yeah.
this is simulation. We shouldn't speak about simulation because I truly believe we shouldn't have simulation. Simulation is giving an unnatural or not realistic expectation to our patients. No. I think I should really only be an assessment tool, and the person, the doctor, doesn't need to do it, what it says to you. It's first for the doctors only, the machine, to let you know. And I think simulation is a huge problem, and all these filters in the world of social media are a huge problem because they really tell our consumers, our patients, that they should look like this in reality, and this is not reality. But as doctors, we have a brain, and if the AI machine tells you could do this tear trough better than more cheeks, then of course it's your doctor's decision what to do and to speak to the patient what to do. Still, I think this AI machine can also control overfilling and also like too big lips, because it will reduce the attractiveness again. So it's all about proportion, and we are just in the beginning, but I think we should train those machines to help us. And you all three of us here, we see aesthetic patients every day. But out there in a normal dermatology office in Germany, at least, in the clinic, they see like 100 patients, and in between there are 2 aesthetic patients. And they have not a long-term experience. So suddenly this patient comes up with an idea or an Instagram photo. And then this doctor can really speak differently to the patient, telling, okay, I have to tailor it for you, but I think this is not possible for you because you look different, you have a different facial shape, but they're not experienced. So a machine like that can help them to really speak to the patient differently and say, you see, this is normal for you, and this is better for you than more lips or more cheeks. I think we can use it to our benefit.
Yeah, so there's a level, Atchima, then, of course, do you think then there's a level of, as you say, for people who are more prone to make mistakes, it gives them a level of expertise. So they've shipped in some expertise coming from some of the top people in the world. This is now in a box to some extent, and they can use that to help them to maintain natural results, to make sure that they have an idea on where to look at, as if they've got your eyes on it at the same as their own. Do you think so, Atchima? I agree with that, and I think there's some huge positives about it. What do you think about the fear for AI that, because to a certain extent, AI is a black box, because of course we don't know exactly how it learns. It learns from patterns. We don't know what patterns exactly, why it's making the decision. That's why intelligence rather than a program. A program would just be a set of data, an algorithm. They're learning, and so we don't know exactly why the decisions are made. Same as this with ourselves. But that means, because it's kind of like a black box, there is a risk that that is taken on by companies, for example, and that's tweaked. And because, of course, the one that you're working on, Sonja, I know about it. And, this is like hugely clever and very ethically done project. But the problem with AI is there's no keeping it in the box. There will be hundreds and hundreds of similar things used by anyone and everyone. So one, it can be tweaked, but also what if they're used to be able to manipulate excessive use of product? For example, there's one fear that people genuinely have about AI, as it would be on social media, like where they very subtly, because it can be done so subtly tweaked, that we have our behavior manipulated because of the tiny parameters that are changed in an AI system.
Yeah, I totally agree with you. I mean, yeah, it can be used to manipulate in terms of business, because with the AI, it can change the beauty stereotype of people, and you can people can take advantage of doing that. And I think it's a pitfall that we need to address, and also we need to educate the public,
Yeah.
educate the
And
patient.
and also interesting, Sonja, not yours, but what there some fears about it, particularly about beauty, is that
Yeah.
some of those AI inputs, the value inputs, are coming from largely male technicians. So this one specifically is about aesthetic experts, yeah. So this is and it's culturally expanded. But in actual fact, lots of AI is the value systems which are inputted are from men and their idea. So this can be embedded into systems without you even knowing it. Like the data is empirical. The value systems are subjective.
Yeah, Kate, I totally agree with you. It's we will have always kind of a danger zone with AI, and it will keep like this. It will stay like this, and but to be honest, I think it's on our side to regulate that a little bit. And we know it's very hard, but I think the better we perform ourselves as a female and
Yeah,
show what we think beauty is, and train these machines and use these machines ethically, then it should be okay. So I'm not too much in fear that male will change the AI to their personal whatever favorite look. I don't think this is possible, to be honest. And but yes, I mean we will see good and bad in AI for sure, as in all fields. But I think we can't close our eyes, and we have to proceed with the digital world, because our young ones are digital. They are technoholics. Let's call them like this. They really live with their phones and with their whatever machine. Laptop. I think laptop is like for grandmothers for them. Soon they have their pets and whatever. So I think we have to keep on going and using our knowledge and expertise and experience to do the best out of it and guide it to the right way, guide it the right way.
That's why we are here.
Yeah.
That's why we are here. We have to group together, and we have to help each other and get this synergy power and get the right data, to the public. Because
100%.
otherwise,
Yep,
nobody do it.
100%. No, that's right. And that's why I think that leadership positions, men and women, but we're particularly
Yeah.
talking about women, it's really
Right.
super important that we challenge what's going on in new technologies, that we understand what's in the black box, that we understand and challenge the value systems which are fed into that. But you're 100% right. But embrace that future. I mean, when we look at regenerative, of course, it's a favorite topic of all of ours. So we look at regeneration, we look at the longevity, and I mean, some amazing AI that came out of UCLA was the fact that an AI system could look at people without treatment and could tell within 4 months of their actual age how old that person is. 4 months. So it was so clever that it would get it right to know that person's age within 4 months. Incredible, really, because it's, of course, looking at all those systems. So it has huge potential. And if we team up AI with, which is exactly what's going to happen, which is an interest of mine particularly, is teaming up AI with biological regenerative procedures or biological anti-aging procedures and understand patterns within that, then of course it's a huge, huge potential. But the onus is on us as leaders in the field, and leaders about seeing the big picture. It's about us seeing that pattern and making sure, like, just as like you've done all these years, is like stepping up into the game and making sure we haul it in a way that's going to be great for everyone.
That's our next project. innovative.
As our next project. Yeah.
His next project.
Is our next thing.
Yeah.
100%.
Yeah.
Great.
Yeah.
Well, it's been amazing. Like, for me, both of you have been instrumental in my life in aesthetic practice, both personally and professionally. Over all the years of working with you, it's been an absolute delight to be with you and chat about these important subjects.
Thank you, Kate.
Same way. Yeah, same here. Yes.
Same for me. It was always lovely to be in the international group with leaders and friends. And I think this is what's all about us, because we are leaders and we exchange unbiased, with no competition, our knowledge. And this is what brings us forward for the future generations. And I'm super proud actually to be in this female group, because we really do things, and we did many things, but I think the power is so strong. With all our backgrounds and expertise, we can do much more. So I see really a bright future, to be honest.
Yeah, I'm totally agree with you. There's a lot of work that we still have a lot of room to make improvement and to become better. I'm so super happy and honored. I feel so blessed to be among all of you.